How do you know if your symptoms are asthma or COPD? Imagine trying to figure out if your breathing issues come from asthma or chronic obstructive pulmonary disease. Both can make you cough, wheeze, and feel short of breath, but knowing the difference is key. Let's look at what sets them apart so you can better understand your health. Asthma symptoms often come in episodes or attacks. During these times, you might wheeze, feel tightness in your chest, cough, or struggle to breathe. These attacks are usually triggered by things like pollen, mold, exercise, cold air, or respiratory infections. Between attacks, breathing can go back to normal. Asthma can start at any age but is more common in younger people or those with allergies or eczema. Chronic obstructive pulmonary disease symptoms tend to stay around most of the time and get worse gradually. People with this condition often have a persistent cough that produces mucus or phlegm. They might also experience ongoing shortness of breath, especially when exerting themselves. In advanced cases, the lips or fingertips may turn a bluish color, which is called cyanosis, due to low oxygen levels. COPD is usually caused by long-term smoking or exposure to lung irritants and mostly affects people over 40. To tell them apart, consider how your symptoms behave. If your breathing issues come and go, especially with triggers like allergens or cold air, asthma is more likely. If your cough is constant with mucus and your breathlessness is ongoing, COPD might be the cause. Asthma attacks tend to involve wheezing and chest tightness, while COPD involves a persistent cough and mucus production. Age is also a clue. Asthma can start early in life and is often linked to allergies. COPD usually develops later, especially if you have a history of smoking. Cyanosis, or a bluish tint around the lips, is more common in COPD. A healthcare provider will look at your medical history, examine you, and perform lung function tests to make a clear diagnosis. These tests measure how well your lungs work and can help distinguish between asthma and COPD. Treatment differs for each. Asthma management focuses on controlling inflammation with inhaled corticosteroids and bronchodilators to prevent attacks. COPD treatment aims to relieving symptoms, slow disease progression, and prevent complications, often with bronchodilators, steroids, and lifestyle changes like quitting smoking. If your symptoms come and go, especially if triggered by allergens or exercise, asthma is more likely. If you have a long history of smoking, a persistent cough with mucus, and ongoing breathlessness, COPD is probable. Sometimes people have features of both conditions, which requires specialized care. Knowing these differences helps you and your healthcare provider manage your breathing health better.